go wrong. We should know, like, the given situation, what is going to be, becoming wrong. So we should expect, what's going to be wrong and how we will, how we are going to get manage the particular event. That is number one, risk identification. Second, what are the chances of it getting going wrong? Like, how much is the chance? It's like 50% or 100%. How much is this particular, chances of occurring this particular risk? That's what risk analysis and evaluation. And how it will, what would be the impact? Like, in case the risk is, the consequence of risk is occurring, how much it's going to affect or impact a particular situation. Maybe it's like a mild, moderate, or severe. How severe it's going to affect, that is called risk evaluation. So the second one is risk analysis and evaluation, where we are going to assess how much is the chance, and in case if it occurs, how much it impacts a situation. And the next one is, so after assessing that, we should go for the risk treatment. The risk treatment is like, what can we do to minimize the chance of this happening? Like, now I'm expecting that something is going to happen. So what can I do in which way I can control that particular, risk in, happening in future, or how to reduce that effect. So that's what risk treatment. So the cost of prevention is compared with the cost of getting it wrong. So always there is a prevention is better than cure, so you know that. So in case, like, if the risk and the consequences have happened, and after the consequences happen, when we are going to give the treatment, and before that, if we are taking an action to prevent that particular risk, so now both the actions, they will see what's financial consequences, which is better. So always prevention is better. So we'll try to do the strategies or goals by which we can control the risk, and we can reduce the effect of risk. The last one is risk control and sharing and learning. So what we can learn from things that have gone wrong. So okay, so the risk has happened and the consequences have occurred. So this is our first experience, from this what we learned and how we can prevent in future. For example, if there is a chance of getting air embolism happened to the patient when given IV infusion, so that's what happened. So if we identified, like, what is the consequences, how to treat this particular patient, and in future to avoid this, how and what are the ways we can prevent this, like priming the tube appropriately, and then just verifying before starting the infusion, and just flushing the IV, cap lock, just flush it and see and check for the return blood flow. So these are the techniques by which we can identify whether there is a chance of getting embolization or not. Then after verifying, then she start an infusion, then the less chance of getting means air embolization. So for whatever the reasons or whatever the risk is going to happen, we should have a protocol or a policy, which is standing protocol. It's supposed to be there in each and every unit of the hospital, so that we understand, like, this is a common procedure is happening in that particular unit. So how to go about, and what are the risks is going to happen related to that particular procedure, and how to prevent the risk. So that should be the protocol and policies or procedure manual should be available, by which so we can control the risk happening in the future. So that's the risk control. So these are the steps by which we can reduce a risk. So in case, in general, so what is the responsibility of the people working, general staff responsibility to control the risk is, number one is reporting the incidents. Like, in case, like, if the risk has happened or something has happened, maybe there is a chance of getting medication error, or there is a patient fall, or there is some consequences happen in the hospital, like the unit where you are working. So number one is the reporting of incident. You should not just hide any incident. If something happened, you have to document and you have to inform. So it should be transparent between you to the patient and the management. So everybody, there should be a transparent in reporting the incident, so that we can get an appropriate action. So in future we can reduce the problems, and overall we can improve the quality of the care if you have the proper reporting. Number one. Number two is identifying and assessing the risk. Okay, so it happened. So what is the risk that is identifying and assessing, and how it happened and why it happened? We have to analyze that and provide additional information on the risk if requested. Maybe your risk management unit or quality unit is asking you about the particular incident, how it happened, and how and what are the ways we can reduce and all those things. If they're asking, so you're supposed to give additional information to them and practice risk management in day-to-day operations within their area. So whichever area you're working in that area, so how to reduce this consequences of risk, or how to avoid the risk, that we have to practice every day in each and every step and every procedure what we are doing. Okay, so these are the common incidents or situations which can happen, like it's a risk. Number one is a nurse may administer the incorrect dose of medication. So that is a risk, so which causes consequences instead of 500. Excuse me. Is that okay? Yeah. Yeah. So the nurse may administer the dose of medication instead of 500 milligrams. They have given 1 gram, or instead of half tablet of metoprolol to antihypertensive patient, they have given 25 milligram. They have to give to 12.5. So if the dose is becoming increased, so this causes a risk for the patient. The patient goes to hypotension, and there's a chance of getting a life-threatening situation. So this is a situation where the nurse giving an incorrect dose of medication, and then a hospital visitor may slip or fall on the freshly mopped surface. So here they have to put the mark, or they have to put a signage board where the floor is wet, be careful, or something supposed to be done. So if it is not done, so they don't understand, so there's a chance of getting fall. And natural disaster, if there is a natural disaster, rain or something like there's some situation where there is a disaster, so that the records, if there is a paper sorting they're doing, and there is a records are getting destroyed, it's a big problem. So in all this is an example of some events, risk situations. If the organization is ordered to pay for the damages in a negligence cases or a fine in an agency enforcement action, it has incurred this kind of financial liability. If any of this, like giving a wrong dose, or there is a fall or slip to the patient visitor, something happened to the visitor, or something happened to the patient, or there is a damage to the records of the patient. So if anything is happened, so it's a responsibility of the hospital to pay. I mean, to manage the financial consequences, or fines to be, for a liability they have to pay. So all this, in other words, it's a financial liability has arisen from unplanned accidental events. So if there is an unplanned event or accident, there is a chance of getting accidental events, risks such as these events. So we have to be careful and organized way and planned way of activities, each and every activity. Even the housekeeping worker doing the work, cleaning the area, they have to have proper procedure when cleaning. So there are some incidents, it happened when I was working in India. So there was a housekeeping worker who cleaned, washroom, and then kept a solution which she used for washing in a table, some random table. So there was another staff entering into the area. It was like a distillery water bottle. So they didn't even know what was the solution inside. It was a clear liquid. So just they thought it's a water, and then they swallowed. So it was like acid, which was causing severe problem, gastritis and burns to the other person. So it was like always anybody working in the hospital, not only the staff, the doctor, anybody, the administrative staff, or housekeeping worker, even a student nurse working in the unit. Everybody should be careful. If anything like a medication or any solution or anything is there, it should be labeled appropriately, and it should be, if it is open, it should be stored in appropriate place. It should not be randomly placed anywhere, so that it prevent the risks. Okay. So this is like Swiss cheese theory, where how the risk is. It's a model where the slice of cheeses. There is a slice of cheeses, and then there is a hole in the cheeses. Each slice of cheese is defensive layer in a process of system. If you take any system, it's like like individual person, it's like organization, the unit, a particular unit you are working. It's a administrative staff, like a different layers of protective layers which is present, defensive layer which is normally present in any system. So there are holes which is present inside the cheese is an opportunity for doing a failure in the particular system. So it's like a model where you can see when all these holes, if the holes are not in appropriate place, it's okay. But if all these holes are aligned in the same, if you organize these layers of the cheese, and if these holes are aligned with each other, there's a chance of getting, hazard from one area, and finally it's causing accident. Okay, so like if you go here, you see that the patient signed a wrong surgical site consent form. So, for example, if a patient is signing the consent form for so for any surgical procedure, it's must that patient has to supposed to sign the consent form. It should be verified by a doctor and a nurse. Nurse is a witness always. So, if they don't check the surgical site, so the patient is signed for the wrong surgical site consent form, and finally they shift the patient to the surgery, and patient is receiving a wrong surgery in the wrong site. Whereas if the patient is signing the wrong surgical site consent form, and in between there are so many layers, like in between the patient is shifting to the perioperative area, there is a nurse in the OR in the preoperative area receiving the patient, and she's checking. The nurse in preoperative area checked and prevented the surgery on the wrong side. She checked and she identified that the form, there is a mistake in the form, the site is not mentioned appropriately, it's wrong. So then before shifting the patient, she identified, so it is changed and it stopped so that the patient received the correct surgery. So that means the checkpoint should be happening in everywhere. Like I am the one responsible from the unit shifting the patient to the OR. So it is my responsibility to do the preoperative checklist perfectly. And in case if I do any mistake, the one who is receiving in the OR, she's supposed to be careful at monitoring everything. It's not like, yeah, she's doing, so she will be done everything in a perfect way, so I can proceed. No. So everybody should do the procedure, take time and verify and do their roles and responsibilities in perfect way. So finally you can prevent something wrong happening, and you can give the quality patient care, and the patient outcome will be better. So what is the purpose of this risk management? Overall, it improves the organizational and client safety, and identify and minimize the risks and liability losses, protect the organization's resources. Yes, it protect the waste of supplies and equipments. Also, we no need to pay the financial aid or financial fines or something if we don't do mistakes, and support regularity and accreditation compliance. So if there is no risk, and if you have, there is no infection in your hospital, and there is less mortality and morbidity in the hospital, and there is a good patient outcome, so then automatically, the accreditation of the hospital will be fine. And creating and maintaining the safe system of the care designed to reduce adverse events and improve the human performance. So if we follow a proper risk management technique, so that overall everything is going in an organized way, so that the performance, the human performance will be perfect, and the quality outcome will be there. Okay, so the domains of risk management, enterprise risk management in healthcare. Number one is, there are different domains. Number one is operational domain. The operational domain includes risk related to the operational management. That's like management, overall the administration and management of the institution. So the internal process, and it may be a problem with inadequate stopping and poor management of adverse events. So it's about the administration. And second one is, there is a risk related to client safety. There is a problem with the numbers. It's number two is clinical and patient safety. So something related to the patient care, like what we saw before. It's like, the risk related to delivery of the care to the customer. They include the problems like medication error, serious safety events, failure to follow the evidence-based approaches in day-to-day nursing care, or any other healthcare activities. And a 2020 study estimated 22,000 patients died due to preventable deaths per year. That means if they carefully monitored, they could they could prevent these deaths. That's around 22,000 deaths in the year 2020. They have conducted the study. That's lower than the previous assessment. Actually, when comparing to the previous studies, it is little lower, but still it is a notable number of deaths happened. If they were careful, they could prevent this number of deaths. And the next one is strategics. This is a risk associated with the organization focus of direction. Potential issues include failure to adopt or media relations, like how they are publishing about their organization, and contractual, like when you are getting contract with the workers, contract with the other organizations in running the organization, and administrative start comings. Like if there is any problem with administration, that is like strategic plan of that particular institution and the direction of institution, maybe like mission and vision and everything. If there is a mission and vision of there is a mission and vision for the hospital or institution, so the activities and the goal, the overall unit, the institution supposed to work towards achieving that particular strategic goal. So they should plan the activities based on that. If there is any problem with this, shortcomings in this administrative and contractual plan, then it is a strategic risk. The next one is financial risk. Is because like if there is anything like it might be the machines, devices, tools in the organizations what we use, it extends to the process and systems. You can also expect to see definition expand. This definition might change because there is a implementation, or we are working based on artificial intelligence, so it might change, the technology might change. For example, the nurses spend a quarter of time on documentation. Mostly most of the time either paper documentation or electronic documentation. So the nurses is spending a lot of time in documentation. But by using AI technique, so the amount of time which is spent on the documentation might be less for the nurse. So it is a good in one way, so that she can spend adequate time in taking care of the patient. But whereas using the AI technology, if the doctor is diagnosing the patient wrongly, maybe because we are using the AI in recognizing MRI scan, CT scan, and all other diagnostic evaluation. Just depending on the AI, we are deciding, oh, this is a diagnosis. But in case if there is a mistake in using the AI, so that the patient is wrongly diagnosed and treatment is given, it's a problem. So there is a technological related risks also present. So we have to be carefully apply any software or any new technology to incorporate into the patient care. So the next one is hazard. The risk in this category related to assets and their values. Some threats include natural disaster, poor management of building, parking areas, and mistake during the construction or renovation in the organizations or a hospital, or it can be a cyber attack. Frequently, this risk is also this risk classification too. Sometimes there is a problem with the threat. Taking the data from the hospital. Like statistics shows, more than 93% of healthcare organizations suffered data breach over the past few years. Like they are, because of just creating a virus and attacking, getting data, stealing the data from the hospital as something it's happening. Even because of this new technology, and the people are having a high, loss of patient identification. So it's a big problem, like being based on HIPAA rules, it's a big problem that we should not reveal any patient's data to anybody outside other than, for treatment, taking care of the patient, treatment of the patient, or, insurance company, which is using, used for this healthcare. Only that people can have this patient data, not anybody else can have this, patient data. It should not be revealed to anybody. Okay, it should be maintained, the safety of the data should be maintained. So the steps of risk management, it can be very depend on the risk. It is not same for all the risks. Each risk is different, and the activity what we are taking to control the risk is different for each risk. For example, the steps taken to monitor, investigate, and prevent the medication error will be different than the steps taken to monitor and investigate and prevent the falls. So you have two risks. One is medication error, another one is patient fall. So the steps taken to control the medication error is different, and the falls is different. So it is based on the risk management is different for different risks. However, from the broader perspective, we have generalized steps. The basic following steps are present. So what are the steps we'll see? Number one is risk identification. Second one is assessment. Third one is risk mitigation, that is controlling. Fourth one is risk monitoring. So followed by we are monitoring that. Next one is reporting. So number one is identifying the risk. So we can use the following data as a source of identification, that is adverse event report. So we supposed to have the report for each and every adverse event which is happening in the unit or in the hospital, so that we can understand in a particular year or a particular month, what are the adverse reaction happen in that particular, risk happen in that particular unit or hospital. So we will understand. So what is how much it is and how we can control that. So that we should have a adverse event reporting system supposed to be there. Next one is mortality and morbidity report. Yes, they have to document. Yeah, surely they'll be documenting, but yeah, they should have a mortality and morbidity report. How much death happened in that particular month or a year, and then what was the reason, cause of death. And the next one is morbidity. After the patient is coming to the hospital, what are the risks happen to the patient and comorbid condition happen to the patient, or hospital acquired problems after admitting to the hospital, what are the other problems happen to the patient. That's supposed to be reported. Next one is patient complaint report. Yeah, sometimes, yes, it's must. I think almost all the hospital follow this. Then when the patient is getting discharged, the patient supposed to we can ask the patient to give the feedback about patient satisfaction survey can be done. So also, each and every corner of that hospital or a unit, there should be a patient complaint box. If they want, they are, voluntarily, if they want to write a complaint about a nurse or a doctor, or about the services they got from the dietary department or any department. If they want any complaints, they can write. In each room, there is a complaint box. They can do that. So that why we are getting this complaint, so that we will understand what is the problem happening and we can improve the services given to the patient. So the patient complaint report supposed to be there, and then assess the frequency and severity of the risk. So also we have to assess how frequently that risk is happening. Patient death is happening frequently, or the patient complaints is happening frequently in the hospital. So we have to assess how frequently that particular risk or event is happening, and severity of the risk, how severe the risk and how it is impacting the patient and the patient relatives or whoever is in healthcare system, how they are getting affected with that. So that we have to identify. So with all these things, we will be able to identify the risk in a perfect way. Next one is severity index, severity assessment code. So it's the risk has happened. So once the risk has happened, we are going to assess how severe the risk, the severity of the risk we are going to assess. So here is a matrix scoring system. So numerical scores are given to the severity and likelihood. We are just giving a numerical score or ratings for the severity of the risk as well as likelihood, how frequently it is occurring. For both of this, we are giving a numerical score, and then we multiply that, and finally we get the rating of the risk. Okay, so here is a table which shows which shows what are the consequences of the risk. If you see that the consequence table, there is serious consequence, major consequence, moderate, minor, and minimum. So there are different type of consequences happen. So it's serious consequences, it's very severe. Major is almost next to severe. Moderate, it's a medium, it's not very severe, not very minimum. And next one is minor and minimum. For example, if you take a serious consequences is the death of the patient. The death of the patient is unrelated to the natural course of illness. The patient came with some other problems, like patient came for appendicitis and then appendicectomy is done, fine. So the patient is in post-operative period, but during that time, so there is the patient got infection and the patient got sepsis and died. So it is not the patient is not expected to die because of appendicitis. It is because the poor care is given in post-operative period and the patient died. So the patient death is not related to the course of illness. It happened unexpectedly. So that means that's a serious problem, and it's like or suspected suicide or homicide which is happening to the patient, or any wrong surgery, site surgery, or wrong patient, they did a infusion or hemolytic blood transfusion, something big happened to the patient, or maternal death associated with the labor and delivery. All of this goes in the serious. And major is like a major or permanent. The patient, because of the hospital procedure or diagnostic procedure or therapeutic procedure, patient got some risks where the patient lost total loss of function. Due to the procedure, the patient got paralysis. Due to the procedure, the patient got fracture in the fall in the hospital. They did not take care properly. The patient got fracture. So this is a major risk. Permanently, the patient is not able to use a particular arm or a leg. You had to do amputation or something in that case. So it's a major risk. So permanently the patient is losing a particular organ and the function. So next one is moderate. Here there is a permanent reduction of the function. The function is present, but it's permanently it is reduced. Before the patient was doing well and performing well, but now because the patient is treated, not treated appropriately, the patient have the complication where the patient function is decreased, sensory function or motor function is decreased because the patient is admitted in this hospital. That's a moderate risk. Minor risk where patient is not having much problem, but still because of our improper care, the patient had to extended stay in the hospital, have to stay long time in the hospital, have to experience an additional investigation or additional reference to the new consultation or something we have to do. That's a minor problem. And minimum, here there is no problem or injuries, but there is just a length of stay is increased, only that. So like different consequences can happen because something risk happened in the hospital to the patient. This is for patient, same thing can happen to the staff, for the visitors, the service the service what we are providing, there might be problem. It can be financial problem or environmental problem. So this different consequences like serious, major, moderate and minor and minimum consequences can happen to anybody. It can be clinical consequences or it can be corporate consequences. Corporate, it includes staff to visitors and to the environment, everything. So this is a consequence table. So next one is probability category. Probabilities, this particular risk, how frequently it's going to occur, or how what is the chance of occurring this particular risk. That is the probability category. That's a, if it is frequent, there is a chance to get, likely, possible, it may be or may not be, unlikely, there is very less chance, and rare, very rare it is occurring. So based on this, it's a likelihood table. So now we are going to multiply the frequency and then the severity, likelihood and the severity scores. For example, if it's like more or less same, it's a severe, they put in a reverse. Severe, it's 5, major 4 score, and then significant is like very, it's like a moderate. Okay, and next one is minor, it's 2, and insignificant, it's 1. Insignificant means it's very less, means less consequences. So that is 1. So there is 5 score is given to this, and almost here we have a possibility, how possibly, probability of occurring. So if it is almost, surely it's going, the risk is going to happen, and that is 5. Likely, there is a chance, that's 4, and then moderate chance, that's 3, and unlikely, it's very less chance, 2, and very rare, it's 1. So we have the score in both the side. Now we will multiply and then we create a risk score. So now 1 into 5, so medium, it's a 5. So the minimum score will be 5 and the maximum will be 25. So if the score, when you multiply this two, we'll get the score between 5 to 25. So based on this, we will decide the patient has a very low chance or very high, extremely high chance to get the risk in the particular situation. Like, for example, if that's very rare and insignificant, the particular risk, then it is very low. So it's very good, safe. But whereas if it is, there is high chance of getting the particular problem, and then if the problem occurs, the consequence is very severe, then it is very extreme. So the step 3, so we can calculate the risk score, like risk level interpretation, like 1 to 4, it's a green picture, which is very low risk, it's acceptable, and you can just monitor the patient. You're not going to do anything else. 5 to 9, it's a yellow, it's a moderate, okay, where there is, you need to do some action. And then 10 to 16, that's an orange color, it's a high risk, immediate action is needed to the patient. 17 to 25, it's a red, dark red, it's a critical risk, urgent intervention is needed. So these are the different categories. We can give the risk score, and then we can identify what type of risk it is and how we have to take care of the patient. So the ways how we can reduce or eliminate the risk, for example, in the healthcare, the scenario is the medication error leads to serious side effects, like if you are given, there is some medication error happened, the event is very severe, so the score will be 4, and the likelihood score will be, the severity is 4, and the chance of occurring is 3. So 3 into 4, 12. The 12 comes in high risk, that is orange. So if there is a high risk, what we will do, we have to do some actions to enhance, we have to give. So what is this medication error? That's our problem. So we have to give adequate training to the staff and double check before giving the medication. Yes, we have to verify, double, triple, how many times you want to check, but you should not give any problem to the patient. So you should not do any mistake. So double check. Then And automated alerts. Automated alert is like you have medication, electronic medication delivery, where you can I mean, you can scan the patient, scan the medication. So when you scan both, so it is matching, then it will go to the patient so that you can reduce the risk. You will not give the wrong drug at all. So the next one is activities commonly used to manage the clinical risks. What are the activities we can use? Means usually done. Number one is incident monitoring. Number two is sentinel events. Three, patient compliant. Fourth one is fitness to practice. So what is this incident monitoring? Incident monitoring, as I said, if any incident is happening, it should be like incident report. Any incident or circumstance that could have or did lead to unintended or unnecessary harm to to complaint or loss or damage. So next one is incident monitoring. It refers to mechanism for identifying and processing, analyzing and reporting the incident. So that means if some incident is happened, it's supposed to be reported, documented and informed to a particular department, and they have to look into it, how it happened and why it happened, how to reduce it, and in case if the consequences happen, so how to treat the consequences. The next one is the type of issues identified in the incident monitoring. So this is a report of a book where there is common incidents happen in a particular hospital. See, the injuries other than the fall, like a burns, pressure injury, physical assault and self-harm, it's 13%. Just plain patient fall is 29%, and medication error is 12%. So followed by you have a wrong diagnosis, inappropriate, poor misuse or failure, malfunctioning of equipment, inadequate, incorrect documentation, contamination, hazardous environment, staff and inadequate resource unavailable of equipments, inexperienced staff, or poor orientation is given to the staff. That's why there is a problem. And then there is a problem with admission, treatment and transportation of the patient. Like that, there are, this is the list of incident which has happened and which causes risk. So this is the list of incident happened in the particular hospital. Activities commonly lead to manage clinical risk. So the second one is, number one is incident report. Number two is sentinel event. This is the way we can reduce clinical risk. Number two, sentinel event. What is that? It's usually unexpected, involving a patient's death or a serious physical or psychological injury to the patient. Example, surgery on the wrong patient or wrong body site, or incompatible blood transfusion. All this is under sentinel events. That means which we cannot manage, which we cannot replace. So it should be mandated report. It should be mandatorily report, and documentation should be done. So this has happened. So what are the how it is the risk associated with this reputation, how it is affecting, and how we are managing that. All this is supposed to be documented, and we should take the necessary action. Number three, the role of complaint. So the next one is complaint. What is complaint? It's defined as expression of dissatisfaction by a patient. That is complaint. It can be patient, family member, or with the healthcare provider. The complaints often highlighted problems that need to be addressed, such as poor communication or suboptimal decision making. They did not make a proper decision, or they did not communicate effectively. So these communication problems are common cause of complaints, as are problems with the treatment and diagnosis. So it should be properly diagnosed, and it should be properly communicated to the patient, and the consequences of disease or consequences of surgery or the side effect of medication, everything should be told to the patient, so that the less chance of getting complaint. So the benefits of complaint. What's the benefit of complaining? Assist the maintenance of high standard. Yeah, if there is so much complaint, it's good. So we will understand what's the problem. So then we can solve it, so that we can maintain the high standard. Reduce the frequency of and litigation. So if we have a complaint and we take a necessary action, we can reduce the frequency of it and help maintaining trust in the profession. Yes, if we are taking a feedback from the patient, and then we are managing that, so that they get a trust in the hospital or a staff, and encourage the self-assessment and protect the public also. So this activity is commonly used to manage. The fourth one is fitness to practice. What is the fitness to practice? So that means you are accountable. You are a nurse, or you are a doctor, or you are a teacher teaching the student in the clinicals, or whoever it is. You're supposed to be, are a student nurse. You are supposed to be accountable for whatever you are doing. You are checking vital signs, you are documenting, you are responsible for that. Okay, you saw that it's a hypertension, you're supposed to inform your nurse, inform your clinical instructor that the blood pressure is above normal. You have to inform them and document that. So you're good. You're in a safe hand. So you're checking the saturation is low. That means you are informing. You will write. So I informed so and so staff, the patient saturation was, just 90, it was not 94, just patient is on room air. So you have to document everything. So that means you're, giving a proper standard of care. So if you know, then if it's less, then you're taking necessary action. If you are not in a position to take the necessary action, you will inform your staff, you'll inform your tutor, so they will identify what is the ways by which we can reduce this problem, so we can improve the care. It's not just you're understanding and seeing something abnormal, okay, just talking to somebody, you're not documenting it properly and nobody knows, you're not communicating, so then the risk is very high. The problems will happen. So fitness to practice, it's a competency of healthcare professionals. So how we can maintain this fitness to practice? Credentialing, registration, licensure and accreditation. So credentialing, that credentialing is just equalization, just verifying this person is appropriate to do this job. He is, studied, his qualification is appropriate to practice this particular profession. So the process of assessing and confronting approval of a person's suitability to provide a specific consumer or patient care. Is this person is suitable to provide care or treatment within the defined limits based on the individual's license, education, training, experience and competency. They see all this and verify this person is credential is given to this person or he is appropriate to practice. Next one is license. License credentialing is just verification of all those qualification, whereas license is given to the person to practice. Like we get a license after you complete your education, you license in a particular state to practice. So if you don't have a license, you are not eligible to practice a particular state. Okay, so we should have a license to practice in each and every state, any medical professionals, including a nurse. So we should have a proper registration. We have to maintain the validity of the registration by continuing education or whatever it is, according to the requirement of the board. Next one is accreditation. Accreditation of the institution. So it can be educational institution or it can be a hospital or any unit, healthcare unit center. So they should have accreditation. That means they are following standard procedures. It's a formal process to ensure delivery of safe and high quality healthcare. By which the standard practice they are following and developed by healthcare professionals for healthcare service. So it's a standard procedures, a standard process followed. The institution is following the standard. So this particular standard is made by the healthcare professionals for healthcare service. So how they make sure? So there is inspections. They have an inspection. So they give accreditation like NABH accreditation. So National Accreditation Board for the Hospital and Healthcare. International accreditation, that's a national and international programs also there. We have JCI accreditation, that's Joint Commission, International accreditation by USA, accreditation Canada. So like that, say examples of different accreditation programs. Okay, so if a hospital is JCI accredited hospital, that means they are maintaining a high standard, international standard to treat the patient internationally. So this is, the hospital is eligible to treat the patient internationally, or national NABH. So India we have NABH accreditation to the hospital. Yes, if they meet the criteria, so they get the accreditation for the particular hospital for a particular year. That means during that period, so they are having all the facilities and supplies and equipments and people and staff and everybody ready to give standard care, so that it means that. So it's the accreditation process. So these are the different techniques by which we can maintain the prevent the risks. And next one is personal strategies for managing the risk and reduce the error. So how you can involve in yourself to reduce the risk. First one is care for oneself. Eat well, sleep well, and look after yourself as a healthcare team member. So when you are good, you are able to focus on taking care of the patient. If you're not sleeping well and you're not taking care and not having adequate energy, you will not be able to take care of the patient. So there is a chance of getting risk and error. Know your environment. So where you're working, you should know your environment. Know your tasks, what you're doing, you should know. And prepare and plan what you're going to do. You have to prepare and plan accordingly. Check into your routine. So always check your routine, what you're doing. It's not because I'm doing repeatedly the same procedure. It's not that I'll just close my eyes and do the procedure. No, every time you will check and do the procedure in the same way, same procedure, same steps you have to follow. Practice a good documentation. So whenever you do any procedures, or document properly. If you're referring the patient, you're sending the patient somewhere, all the documents should go along with the patient, provide sufficient information. And if there is any relevant information regarding the diagnosis and treatment, it should be documented with the date and time. Okay. There are personal strategies for reducing the risks. Number one, report any risk or hazard incident in your workplace. If you if you come across any risk or any incident happened in your workplace, it is must that you have to report to your authority whom you have to report. If you are a student, with your staff. If you're a staff working in the hospital, you're a unit director or unit manager, or according to the line of authority you have to follow, and you have to inform the incident, participate in meeting to discuss the risk management and patient safety. So whenever there is an in-service education program happens, so for participate in the event and risk management patient safety programs, report appropriately to the patient and families after the adverse event. It is not that necessary that you have to hide from the family. If something happened wrong, talk to them, inform them that something has gone wrong, so we are taking a necessary action. There is a department, we are analyzing and seeing and what's gone wrong, and we will take necessary action. We are responsible for that. So be transparent to them, and you have to solve the problems. Respond appropriately for any complaints or anything. Ask if you do not know. If you don't know, so say you don't know. It's not necessary, yeah. So they may say something, so I have to do the procedure without knowing. Don't do anything. If you don't know, say don't know, and ask somebody who knows it, and then learn, and then you can do it. Why clinical risk is relevant to the patient safety? So clinical risk management is specifically concerned with improving the quality. Risk management is always going with the quality and safety of the healthcare services by identifying circumstances and the opportunities and put the patient at the risk, and to prevent and control those particular risks. So this is risk management and patient safety is going hand in hand. Both overall helps to improve the quality of patient care. So quality in healthcare always begins with ensuring the patient safety. Okay, talking with the patient. So you have to always, quality in healthcare begins with patient safety. Our main aim is first, do no harm. Okay, the definition of patient safety, it's an avoidance and prevention and amelioration of adverse outcomes or injuries stemming from the process of healthcare. Just we are avoiding and preventing the harm happening to the patient. It is a reduction of risk of unnecessary harm associated with the healthcare to acceptable minimum. That means it's not necessary that we are causing some risk to the patient. Acceptable minimum, we try to do the procedures or things what we are taking care, services what we are providing to the patient to the acceptable minimum. So that's what the WHO definition of patient safety. So what is patient harm? It's we are just avoiding unnecessary harm resulting or contributed by healthcare. This includes the absence of indicated medical treatment. So by medical treatment or something, we should not do any harm to the patient. And what is adverse event? It's an incident during care that results in patient harm. It's just an incident. Adverse event is an incident. So the key facts, so around 1 in every 10 patients is harmed in the healthcare. More than 3 million deaths occur annually due to unsafe care. So only because of carelessness or avoiding or just not bothering much or not giving a safe care, 3 million patients are dying each year. And in the low to middle, it's happening in the low to middle income countries. As many as 4 in 100 people die from unsafe care. So in low to middle income countries, there is 4 in 100 people are dying because of unsafe care, not because of the disease. It is because of unsafe or wrong medical treatment or diagnosis or something, they're dying. So need to be careful. And above 50% of harm, that is 1 in every 20 patients is the harm can be prevented. Half of this harm is attributed to the medications. Mostly the harm is happening due to the medication error, and 50% of that we can control, and it's preventable if we are careful. Some estimates suggest that as many as 4 in 10 patients are harmed in primary and ambulatory care setting, while up to 80% of the harm can be avoided. So what they're telling is 4 to 10 patients are having this risk, 80% of this can be avoided if we are very careful. The common adverse events, that is results avoidable patient harm as medication errors, unsafe. So what's the events commonly happening? Because medication error, unsafe surgical procedure, healthcare associated infections, because the patient coming into the hospital and we are not maintaining the safe environment, so patient is getting infection from the hospital, and diagnostic error, patient fall, pressure ulcers, patient misidentification, unsafe blood transfusion, and venous thromboembolism. So these are the common adverse events happening in the hospital. Patient harm potentially reduces global economic growth by 0.7% a year. On the global scale, the indirect cost of harm amounts trillions of US dollar every year. So the harm is happening, and the way we are managing and the amount of money what we're spending in managing the risk and consequences of the risk is so much. So we have to be always very careful to prevent the risk. So invest in reducing the patient harm can lead to significant financial savings, and more importantly, better patient outcomes. An example, good return on investment is patient engagement, which is done well, can reduce the burden of harm by up to 15%. So always have, patient engagement, talking with the patient, communicating with the patient, and, acting according to the rights of the patient, so that we can reduce the 15% of that. Why patient safety is important in the hospital? Hospital is a people intensive place, and where there is a lot of people, it's a people place, and provide services to sick people around the clock, 24 hours daily, 365 days a year. People have free access to entry in any part of the hospital anytime for advice and treatment. So the hospital atmosphere is filled with emotions, excitement, life, happiness, death, and sorrow. Since the hospital operates under continuous strain, it gives rise to irritation. Yeah, because the people are working, round the clock with a shift, 3 shifts and continuously. So there is a chance of getting irritation, stress, confrontation, conflicts, aggression, threatening to the life of the hospital staff. All these things can happen, and it can be a threat to the patient, or staff, or to the hospital property. Common adverse events, as I said, medication error, hospital-acquired infection, falls, pressure ulcer, thromboembolism, diagnostic error or delay in the diagnosis, death during interventions, unsafe surgical care, unsafe transfusion practices, radiation or error, sepsis, unsafe care in the mental health care settings. All these are the common adverse events can happen in the hospital. And some reasons why this error occur, there are two categories of factors. One is systemic factors, another one is human factor. The systemic factor is complexity of healthcare process and complexity of healthcare environment, lack of administration practices in the hospital, deferred maintenance, and clumsy of the technology. And then human factors are limited knowledge, poor application of the knowledge, or fatigue, suboptimal teamwork, there is no teamwork, attention, distraction, inadequate training, and reliance on the memory, and just they are relying on the memory, not on the documents and the process or procedure, or poor handwriting. So because of all this, there is a chance of getting error in the hospital. That's why there is a chance of getting error. So global burden of patient harm in healthcare, it is estimated that 64 million disability adjusted life years are lost. That means 64 million years are lost every year because of unsafe care worldwide. So this is overall the life year, which is calculating for each patient how much years is lost because of this error. So this is 64 million disability. It can be death or it can be disability. So disability adjusted life years are lost because of unsafe care. This means that the patient harm due to adverse events is one of the top 10 causes of death and disability in the world. That means, so this adverse events are topmost reasons to get the death or disability for the patient. So the available evidence suggests that annually 134 million adverse events due to unsafe care occurs in the low and middle income countries, and 2.6 million deaths are happening due to this unsafe care. Approximately 2/3 of global burden of adverse events results from unsafe care, including disability adjustment life years lost from them, especially in the low and middle income countries. Estimated indicate that high income countries, about 1 in 10 patients is harmed while receiving the care in the hospital. So this is an incidence. There are 6 dimensions for the quality with the safety of the patient and family. So what they need, the patient and family. Number 1 is safe. They want to be safe, avoiding injuries to the patient from the care that is intended to help them. Second one is effective. Provide the services based on the scientific knowledge. So whatever care you are giving, go based on the procedure steps and policies, and there should be policies and procedures and protocol for each incident or a situation if it happens, on each procedure. So it should be patient centered. Provide care based on respect the patient and respect the patient's color, caste, creed, everything. So there should not be any changes. If it's a patient from this area, it's a different care. If the patient from this area, different care. Patient rich, different. Patient poor, different. No, you have to be based on the patient's values, needs, and preferences, and be respectful for the patient and responsive to the individual, and give appropriate patient-centered care to the patient in the clinical decision and everything. Timely, reduce the weight the patient is coming to the hospital in a ER, emergency room, or the patient is waiting for the surgery, or if the patient is in any unit, if the patient is using a call bell and calling you, patient should not wait. Reduce the wait time, sometimes harmful delays for both those who receive the care or who give the care. So the nurse is waiting to do the procedure, but the equipment is not working to give the care to the patients. Infusion pump is not working when you're giving medication, so that's a problem. So, or the patient wants a pain medication and you didn't go for an hour, still the patient is on pain, so it's a problem. So it should be timely, so the patient should not wait for it. Next one is efficient. Avoid waste, including waste of equipment, supplies, and ideas and energy. Don't waste anything. What is necessary? You want to use PPE, personal protective equipment, use appropriately. You're using a medication, you're using some solution to clean something, so use appropriately how much you're going to use. Don't waste the supplies and equipment, even ideas and energy. Your energy also, you're doing some procedure, you want to do the procedure to the patient and keep the patient in your working level. Don't keep the patient in lower level and you're bending too much and straining your back. So save your energy also. Should be efficient. Next one is equitable. Provide care that does not vary in the quality because the personal characteristics such as gender. Is a male patient different care, female patient no. It should be gender equality. And ethnicity, because the patient is Indian, the patient is American, the patient is from Philippines. No, everybody should have same care. Geographic location, yeah, patient is from South India, North India. No, there should be all the patient is patient. Anybody comes to your care, they should receive equitable care, and also based on the socioeconomic status. But we can see, so because of all these reasons, there is inequitable care is given. That's why the risk is high and patient is not satisfied. Yes. So for the patient satisfaction, there are 6 goals which is derived by International Patient Safety Goals. So this standard issued by Joint Commission International as a part of the quality and safety standard of patients. So there are 6 goals. Number 1 is, it is always how to prevent the harm or risk. Yes, number 1 is identify the patient correctly. 2, improve the effective communication. 3, improve the safe and high alert medication. And 4th is ensure the safety surgery. 5th one is reduce the risk of health care associated infection. 6th one is reduce the risk of patient harm resulting from the fall. So this is the 6 international patient safety goals by which we can reduce the risk and improve the patient safety. Patient identification, very well how to identify the patient. We'll identify the patient by means of positive identification, like just by the name and date of birth. Always you have to use the 2 identifiers, the patient name and the date of birth, because sometimes the patient will be having same name 2 or 3 patients in the same unit. So you have to be verify always with the 2 identification, that is date of birth and the verification of the patient. If the patient is able to speak, okay, if the patient is not able to speak, unconscious or unresponsive or something like that, if the patient is coma or something, you can identify with the identification tag where the patient name and date of birth supposed to be there. Okay, and if the patient when the patient's identification is done, it is before, when you will do that, before administering any medication, before giving any blood and blood products to the patient, before sending the patient laboratory examination, prior to any medical procedure, radiological procedure, patient transfer, or any procedure, you have to do the patient identification. What identification should be printed on the patient identification bracelet? That is 2 things. One is name and date of birth. So these are the different identification bracelet. The blue color for the male patient contains the patient's identity. The pink color for the female patient containing patient identity. Red for the patient who are allergic to the drugs. So if you see somebody having the red, that means the patient has some allergy. What is that? It may be drug, food, or any special allergy, seafood or anything. Because the patient is going for angiogram, patient has to go, undergo using the dye. The patient has to undergo the procedure. If the patient is allergic to the seafood or iodine allergy, that means you have to be careful. You will not do the procedure with that contrast media. Okay, so the red is something which is causing, indicating the patient has allergy. So you have to check what it is. Purple color for DNR. What is DNR? Do not resuscitate the patient. So if the patient is going for like cardiorespiratory failure, if the patient has this purple color, that indicates the patient is DNR. That means you are not going to do the resuscitation, no CPR. Okay, that means that's a patient decision. You have to respect that. Okay, orange color for the patient at a risk of falling. That means why the patient is having a risk of fall. It may be because under the influence of sedation, drugs, or it is because of the patient is aggressive, that's why there is a fall risk, or patient is old age, so there is a risk. So the orange color indicates the patient is fall risk. Okay, patient who are unconscious or uncooperative, infants or children, identification is done by matching the patient's bracelet identity on the medical record. So that means if small children are infants, so they cannot say their name and date of birth. So you can compare with the their chart and the patient's identification band. Both you can compare. It's a not. Okay, or you can do the verification with two nurses. You can confirm the patient identification. Okay. The next one is the goal 2, how to improve the communication. That is, number 1 is S bar, number 2 is write, read back and confirm. What is S bar? S bar is a situation, background, A for assessment, or for response or recommendation. So what is that S bar? It's a situation when you're, for example, you are in the unit, okay, the nurse is there round the clock in the unit, but something during the night shift or in the evening shift, something gone wrong about the patient. Now you want to communicate this incident to the doctor. So before that, this is a S-bar technique by which you have to communicate to the patient, provider, physician. What is that? Number 1, you will tell what is the situation, a statement, what is going on now with your patient, and the background, overall, what about the patient, short summary about the patient, that's the background of the patient, assessment, and what is your assessment finding in that particular situation, that is assessment. Okay, and recommendation. So what you feel, it's not that, so this is something happened to the patient, so give order for the new medication, something. It's not like that. What you feel, this is because of this reason I feel if we give this, the patient will be fine. That is your recommendation. How can you give the recommendation? It is based on your knowledge. If you have enough knowledge, you can recommend this. You can do the proper assessment, what is the disease and what is the thing, risk is happening to the patient, what's the problem is happening to the patient, and how we can solve. For example, okay, I can just show you example, like S-bar briefing, like situation. Like, for example, you're calling Dr. Jones, for example. Okay, Dr. Jones, I have a 55-year-old male who looks pale. Male patient men who looks pale, sweaty, and is complaining of chest pressure. This is your situation. What's the background about the patient? He has a history of hypertension overall, like about his summary. Admitted for GI bleeding, received 2 units of blood, and last critic 2 hours ago was 31. The vital signs are blood pressure 90/50, pulse is 120. So this is the background of the patient. So next one is your assessment findings. What you're assessed. I think he's got active bleeding. I feel the patient is having active bleeding. That's why you see the blood pressure is 90/50 and the pulse is 120. What it indicates, hypotension and tachycardia, which shows the patient has a shock. It's a signs of shock. Okay, so that's what the nurse is telling. I think the patient is having active bleeding. Why the patient is going for shock? Because there is a bleeding, hypovolemic shock. I think the patient is an active bleeding, and we cannot rule out MI. We cannot say there is MI, myocardial infarction, but because we do not have the troponin or recent H and H. What is H and H? Hemoglobin and hematocrit. So if there is a hemoglobin and hematocrit, we can say there is extreme blood loss. So if it is less than 7 hemoglobin, then you can go for blood transfusion. If the patient is having MI, so you have to check the troponin, cardiac enzymes, troponin level, then you can say MI. But now you're not able to say MI, or you're not able to say anything about H and H because you don't have the value. So you think it is active bleeding. Why you think it's active bleeding? Because the blood pressure is 90/50, the pulse is 120. Also, the patient has a history of GI bleeding. This gives you an idea the patient is having, bleeding. That's what you are thinking. So now you can say your recommendation. I would like you to get the ECG. Yes, why are you doing ECG? You want to check whether there is any problem with the chest pain. You want to rule out there is no problem with the MI. And lab like troponin, cardiac enzymes you can do, and H and H you can do, so that you can come to the conclusion it's because of bleeding or because of MI or something else. I need for you to evaluate him right away. So this is what your recommendation. So you're calling a doctor in a phone, and then you're telling all those things. So then the other person, the doctor who is clear, so then they can give an order for you for doing EKG and lab, as well as he can come and check the patient, so we can save the patient as soon as possible. Next one is, how do we use the T-back technique? What is T-back technique? It's like, that's what you call the doctor, right? And then he's giving you some order, sometimes giving telephonic order for medication. So how to do this telephonic order? Number one is tulis baka ko pharmacy. This is Indonesian language. So what does it mean? Like write, read back, and confirm. So you receive some message from a provider or a doctor, write the message, you have to write it, conveyed in appropriate form. You have a form where to get the telephonic order, take a form, and whatever message you are receiving, from whom you are receiving the message, at what time, date, and with everything, you have to write the message. Like the doctor is telling you, give Tylenol, paracetamol, 1 gram IV to reduce the fever of the patient. If in case, if they're telling, you will write it. Who told, which doctor, and what's the time, date, and what's the dose, and that you have to write, number one. Number two, reread the written message, put a read back stamp under the message. Okay, after writing that, Dr. Jones, so this patient, now you told it is Tylenol, aspirin, paracetamol, IV, 1 gram you want me to give. So is that okay? This order is okay. Read back to the person and then verify, yeah, it is fine. Then you put the stamp that it is already, verified. Next one is reconfirm the truth of the message written to the informer. Again, you have to tell to the doctor third time, confirm, yeah. So the patient has the fever, is uncontrollable with this oral medication, and patient is not able to take, patient is having vomiting or something, but the patient is suffering with high fever and pain and so much things. So that you have ordered paracetamol 1000 gram IV. So I'm going to give stat IV. So you read again so that you will not have any problem. There is no mistakes. And then if you get the telephonic order within 24 hours, the provider, the doctor has to come and sign that particular order. That means, yes, it's agreed. I am the one given the order, which should be done within 24 hours. Okay, writing instruction must be complete. When I write an instruction or some order or some telephonic or something I'm getting, I have to see that it should be complete, legible, so that anybody can read, and then there will not be any mistake. Okay, and if I write the telephonic order, another nurse should co-sign with me. Okay, so there will not be any problem. Avoid using non-standard brief. Like for example, you're writing USA. What is USA? Unstable angina. No, it is not standard. Okay, you have to write unstable angina. Don't write USA. Okay, so you're writing MI, it's standard. Myocardial infarction, it's a standard one. Okay, whenever you write acronyms, symbol, or whatever it is, it should be standard one. With that you have to put. You don't write PT for a patient. PT slept. PT is not patient. Like patient, you have to write patient. Okay, perform handover between shift as well as between the unit appropriately. Whenever you give the report, it should be between in the bedside, and it should be given appropriately. Okay, the next one is goal 3, improve the patient safety of high alert medication. How you can check about the high alert medication means, like the drugs supposed to be, whenever you give some drugs, there are some drugs which the nurse can take. There are some drugs which should be under lock, like sedatives, narcotics, and all those things. Okay, narcotic analgesics, morphine, pethidine, fentanyl, all those things. Hello, excuse me. Yeah, am I okay? Yeah. Yeah, so next one is look-alike drugs. So there are some drugs, it's look-alike or sound-alike. It looks similar. So we have to be very careful, like hydrocortisone, hydroxyzine, clonidine, clonazepam. So when you get the order for this medication, you have to be very careful, and it should be checked. And the next one is, when you give medication, it should be sticker. There should be adequate sticker for high alert medication. And then when you give the infusion, if there is a high alert medication is going for the patient, high risk medication, you have to put the red sticker with what is the name of the medication, how much, and how much dose is going for the patient. Everything should be there with the sticker, so anybody coming that they can understand. And before doing if you are putting a medication in the cup, syringe, or any bottle, any solution is there, you have to put the label so that everybody will be understanding, and you can reduce the risk. Take extra care with the patient who take blood thinners. What is blood thinner? Like heparin, anticoagulants. If the patient is taking anticoagulants, need to be very careful to prevent complications like bleeding or anything. And record pass along the correct information about the medication. So you are in one shift, another you are giving handover to the another nurse. So you have to give appropriately the handover about the medication and everything. What is the new order? Is there is any change in the order? Is there is any change in the dose, change in the route? Everything to be communicated properly. Okay. And the next one is fourth goal for the patient safety, ensure the safety surgery. Yeah. So the safety surgery is very important. So you have to have a surgical safety checklist by WHO. We have that. Number one, before induction of anesthesia, what you have to do, before skin incision, what you have to do, before patient leaves the operation room. So before the induction of anesthesia, has the patient confirmed identity? Confirm the identity, site is marked. Yeah, which particular area you are going to do the surgery? Right side of the abdomen, left side of the abdomen, right hand or left hand, where? Which are supposed to be marked. Is the anesthesia machine or medication check complete? Is machine is perfect, the medications are perfect, is the pulse oximeter on the patient is functioning well, does the patient have any allergy, any difficulty in aspiration, or if there is any blood is, if there is a expecting you are doing a surgery for a longer time and expecting there is a blood loss so much, then you have to keep ready for the blood transfusion. Okay, so this all should be done before giving anesthesia to the patient. And then next one is before skin incision. Before doing the skin incision, confirm all the team members introduce themselves by the name. Yeah, there are team surgeon, assistant surgeon, anesthetist, assistant anesthetist, scrub nurse, circulatory nurse, so many people, and technician, assistant, or whoever it is. Everybody should, as a team, they have to orient with each other. They should know their names, and then the procedure, their roles, what they are doing, each individual. So they should know everything. So then they have to start the procedure. If the patient has a procedure with antibiotic prophylaxis, should be given just before the last 30 minutes. It's given. And then if the doctor is supposed to be confirmed the patient is is there any specific concern, how much blood loss is expected, how long the case is going to take, everything should be confirmed. And to the nursing team, the sterile, they have to maintain, prepare the equipments, maintain the sterility. If there is any issues in the equipment, they have to verify the circulating nurse. Any image, if during the procedure, if they want to check the MRI, X-ray or anything, the image supposed to be displayed properly. And then finally, before the patient is leaving the operation room, nurse verbally confirm the name of the procedure, what is the procedure they done, the completion of instrument, that the sponge count, how many sponges and instrument before the procedure and after the procedure, they have to check to prevent leaving any instrument or a sponge or anything inside the patient. Accidentally it can happen. So you have to count before starting the procedure how much sponge you're using, how many instruments you're using, and after the procedure how much you're using, that you have to confirm, so that it should be same. You did not leave anything inside the patient. And specimen label, if you receive any specimen and sending for the study, that should be labeled appropriately, whether there are any equipment problem addressed during the procedure. And surgeon and anesthesia, they have to what are the key concern, the recovery of the patient. Is there anything specific for this particular patient during the post anesthesia care unit, that you have to be, that surgeon and anesthetist and nurse have to confirm and discuss and verify. Ensure the safety surgery, as I said, the same thing, before surgery, during the procedure and after the procedure, what they have to do. They have to just conduct assessment and determine preoperative diagnosis, explain and educate the patient and family about that. Whether there is any chance of getting CT and MRI, it should be done before. Make sure all the lab investigations are done, surgical site is marked or not, play a role in carrying out the timeout procedure. So they have to do it properly. As a nurses, what we can do is verify completeness of the preoperative checklist. Everything is going well. Informed consent is taken from the patient. Correct patient is identified or not. Check whether the informed consent is filled completely, doctor and co-signed by the nurse. Check whether there is any site marking. If you have to do, there is bilateral site, like right hand, left hand, it should be marked where you are going to do surgery. For example, there is an amputation of finger, which finger it's supposed to be marked. And then marking is done by the surgeon. So who is doing this marking? The surgeon is doing about the organ, which organ they are doing. Usually they do the marking for the bilateral places and which area they are doing. They don't do marking for peritoneum or any other mucosal membrane or something. That if there is a teeth, it should be marked properly in the photo. And check whether there is photo, MRI, CT to be done. Check prophylactic antibiotic is given hour before. Check there is a blood preparation is done. If you're doing a long surgery, need for a blood transfusion to be get ready. Case has a patient given a preoperative visit by anesthetist, should be always the anesthetist should check the patient is fit for anesthesia or not before the procedure. The fifth one is reduce the risk of healthcare associated infection. Yeah. So it's very important that in the hospital that we are not going to give any infection to the patient. What we can do, number one, number 10, number 1,000. The first one is how to wash your hands. Yeah. So you should know the technique. I think you know very well after this pandemic, everybody know how to do the hand washing. I mean, before that they know, but now they give more emphasis to the hand washing. That is, this is a technique which you have to follow for the hand washing, like, rubbing hand with palm to palm, then back of the fingers with the opposite palm, then back of one hand with another hand with interlocking the fingers and reaching the thumb clasps in opposite hand, rub the palm together with, fingers locked, and rub the tips of the fingers with in the palm. That I have to do. This is the steps which you have to follow during the hand washing. When you have to wash the hands, this is 5 moments of hand hygiene. When before touching the patient, before procedure, after touching the patient. After the any touching the body fluids or exposure to the risk of body fluids or anything. Then after the procedure or touching the patient, and after finally touching the patient's surroundings, also you have to do the hand washing. So by which we can reduce the risk of infection. Also, like to reduce the risk of infection, you can use the PPE, patient protective equipments, like personal protective equipments like gown, gloves, mask, and everything appropriately. Sixth one is reduce the risk of the patient's harm resulting from the fall. Yeah, it's a very dangerous problem. All the patients who come to the outpatients and to the inpatients are assessed for the fall risk. So you have a fall risk scale called Morse fall risk assessment scale, like which says like patient is oriented, alert, awake, patient has sedative medications or not, patient has IV or not, patient has using any assistive devices or not. Based on that, we give the score. So then we come to the conclusion how much score the patient is getting. Then we'll decide high fall risk, moderate, or minimum fall risk or something like that. That you have to do for all the patient, so that you can give a fall risk band. If there is a risk, then the patient will be very careful, and the patient to be educated to prevent the fall risk. And actions that can be taken to prevent the patient from falling must be carried out. What you can do to prevent the falling, like you can keep the side rails up always, and then the room supposed to be clutter free, so it's easy for the patient to be mobile. And then give the patient call bill so that the patient will call you. Patient will not try to move out of the bed. Keep the necessary items near to the bedside so the patient will be fine. He will not be trying to move out. If the patient is not conscious and high fall risk and aggressive on something, you can restrain. The restraint supposed to be done with order with the physician. Every 24 hours you should get the new order for the restraining the patient. Otherwise it's a harm to the patient, it's illegal. So we have to take that with prescription. You have to do the restraining the patient. And then so you should know how to prevent the fall risk. If the patient is in the hospital, so the beds should be the lowest position. You have to keep the bed in the lowest position. That means reduce the height of the bed so that if the patient is falling also, it will not be in so much height. You can keep, if there is a high risk, you can keep the smallest, thin mattress in the side of the bed so that the patient will not fall. So all these things, and lock the chair, lock the bed when the patient is in the bed, so that the bed will not move and cause the fall risk. Okay, that's about the way to reduce most burden events. Okay, so before that, 5, and reduce the risk of patient harm from the falls. That's about the 6. So we finished all the 6 goals, and how we will reduce clinical level of interventions using the systemic perspective. Number 1 is VTE prophylaxis, that is venous thromboembolism prophylaxis. What is that? That means to prevent the venous thromboembolism, we have to use different techniques. Number 1, early ambulation of the patient after any procedure. Number 2, can give low molecular heparin for all the patients who have high risk of developing clot formation. You expect the patient is not going to move for some time, and the patient is in the hospital for a while. So then you can give heparin, warfarin, or something low molecular, so that the patient's risk of infection, risk of thromboembolism can be prevented. You can use stockings to the patient so that it will be compressing. It's good for the patient. Or sequential compressive device. There is a sequential compressive device, like it applies a pressure and release continuously, so that it will prevent the pooling of blood in the lower extremities and prevent thromboembolism. And there are some protocols to minimize. One is centralized central line catheter insertion. If there is a CVC catheter, central line catheter insertion procedure is there, you should have a standard protocol to prevent the risk of infection. pressure injury, how to prevent the pressure injury, changing the position every 2 hours, and then, assess the skin of the patient. You have to use the scale, broad and scale, to check the pressure injury of the patient. And then if there is a risk, you have to take care appropriately. Use the, air cushion, water mattress, or air mattress, or whatever it is, or pillows, something, and change the position frequently so that you can reduce the pressure injury, and give technique massage or something to the patient to prevent, and apply some creams and to prevent dryness, so that there is a risk of injury is less. And urinary catheter associated infection check, it's must the patient has to have this Foley catheter or not, how long the patient is having catheter, check the signs of infection, check the tubing, whether there is any cloudy appearance, whether there is a color change or anything is present. If the patient has a fever, mostly the patients with old age having urinary catheter, they go for delirium, okay, getting sepsis, high chance of getting sepsis. So you have to verify, is it necessary to have this catheter? If not, they have to remove the catheter. How? You have to check, just remove the catheter, check the blood, do the bladder scanning every 6 hours, and see that the patient is retaining the urine or not. If the patient is retaining more than 500 ml every 6 hours, that means you need to do straight cath. Straight cath, you will put the cath and remove, so that there is no risk of infection. 2-3 times you have to do the straight cath, then you have to put the patient back to the Foley catheter. If not, if once you're removing the Foley's catheter, and then the patient can able to use the urinal and void, it's well and good. So you can prevent the infection. Unnecessarily leaving the catheter inside the patient causes infection. Next one is procedure and surgical checklist. Prepare the patient for this procedure so that you can prevent, a risk in the surgical procedure. How to improve the patient safety in the institution? Use the evidence-based practice guidelines. Retention of experienced staff nurses. Yeah, there should be an adequate experienced staff nurses should be there. And then they have to give proper orientation to the newcomers. Accreditation of service, continually improve the quality of the care. Yeah, the hospital is supposed to have the accreditation so that they will have a standard, so they can have a good quality patient care. Control admitting department. So the admitting department is supposed to be having, proper procedure. So whoever comes to identify the patient properly, and the name, age, date of birth, everything supposed to be proper, so that we will not do misdiagnosis, misprocedure or something cannot be done. So that they have to work properly. Administrative intervention. So overall, the administrative intervention, they have to have a standard strategies, plans, policies, and protocols for each and every procedure in each and every unit, so that they will have less chance of, improved patient safety and less risks. The tips for patient safety is, constitute of patient safety committee. There should be patient safety and risk management committee in the hospital. Develop clear policies and protocol for the patient safety. Discuss regularly the patient safety initiative with the hospital staff. Okay. Okay. I think I'm finishing it. Okay. Yeah. So discuss regularly the patient initiative with the hospital staff. Okay, orientation and reorientation of the staff. Encourage the transparency in the hospital incidents and death, whatever happened, and non-punitive incident report. So if there is some incident happened, it's not like giving punishment to the particular person involved. Just you have to, inquire about the problem and how to solve that problem. We have to see, it's not like, blaming them. Each department have their safety protocol, and investigate any accident or incident, and review and monitor and evaluate the procedures. So improving the patient safety with AI, so you can predict the AI can predict the analysis and the risk which is going to happen, so that they can understand what reaction is going to happen, what is potential drug reaction and complication. So it is helpful. And medical imaging, they can use a medical imaging, like, to diagnose a particular procedure based on X-rays and MRI. So the AI can diagnose that instead of, the doctor. It can reduce the error. And robotic surgery can be done, so it should be more precise, and it is perfect to reduce the surgical complication. In summary, healthcare professionals are responsible for the treatment and care, so they have to be very careful. Personal accountability is important, as any person in chain of, everybody should be responsible. And one way of professional help to prevent adverse event is to identify areas prone to the error. So which area there is a high risk of, we have high risk of a problem that we have to identify, and proactive intervention of system approach to minimize the opportunities of error. So identify the areas of error and minimize the risk of it. And individuals can also work to maintain safe clinical working environment by looking after their own health. So we have to take care of ourselves so that we can give a better care to the patient. So that's about the presentation. I'm sorry, I exceeded the time. Hope everybody understood. And is there any question? Yeah.
Are there any questions? No questions from the audience? Ma'am, no questions from the audience?
Okay. Okay, thank you. I hope everybody understood. So the patient safety and risk management is, an important topic, and which we have to be very careful whenever we are doing any endeavors, any activities, so that we can reduce the risk and harm to the patient and to us, so that we can serve better. And thank you for the, principal Deepthi Chukla, and then the organizing committee, the panelists, the speakers, and other co-speakers, and everybody, and the audience, the students. Thank you for giving opportunity, and have a great day. Thank you.
So I would like to extend my sincere gratitude to our esteemed speaker, Ms. Vasantha Guruswamy ma'am, for sharing their valuable insights and expertise with us. So I would like to summarize some key points from the lectures. So ma'am has discussed about the risk management and patient safety, how it is important to deliver during the patient care in hospitals, and clinical risk management, and what are the responsibilities of staffs for risk management, and the risk of financial liability can be found in many situations, what are the purpose of risk management, then enterprise risk management process, then global burden of patient harm in healthcare, and why patient safety is important in hospitals. And ma'am has discussed 6 dimensions for quality with patient safety to patient and their families, and international patient safety goals. So once again, I would like to thank you, our speaker, Ms. Vasantha Guruswamy ma'am, for their enlightening presentation. Your presence here today has enriched our understanding risk management and patient safety, and I also appreciate the active engagement from our audience. So thank you all for your attention, and I wish you a great day ahead. Thank you.
Thank, thank you. Thank you so much. I'm leaving. Thank you. Have a good day.
Thank you, Mrs. Anamika ma'am, for your valuable feedback. And before moving forward with our further sessions, there's an announcement of high tea. You're all invited for the high tea, and the venue for the high tea remains the same for all the speakers, chairpersons, and guests. The venue is on the left from the auditorium, and everybody else, all the faculty delegates, student delegates, in the ground. Thank you.
Saga of TNAI, a journey of selflessness, dedication, and care. Moving ahead with commitment and dedication since 1908. Following in her footsteps, a band of 9 visionary women formed the Association of